Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is how to prep your child for surgery. What can a parent do to prepare a child for surgery?
A parent should sit down with them, start from what they know, start from the things that are on their body that hurt them every day, or whatever they're coming in for surgery for. You start with those things that are information that they already know and that they see every day. You work on and give them more information as needed. You can talk about anesthesia, you can talk about all of those things that they're going to be seeing, but you don't have to. You can listen to what they say. If they ask questions, kids are honest. Kids will ask you if they want to know.
Can you tell a kid too much?
If you bring it up and they begin to cry, they shiver a little bit, they get a little bit nervous, you can stop. You don't have to move forward. If you think that this conversation is going to produce more anxiety, then you don't have to talk about it.
How does Child Life at UMass Memorial help parents and children prepare for surgery?
If we are consulted before, whether it's by the surgeon when they go for pre-testing or a doctor's appointment before, we are able to call a parent before the surgery, before they come in. We can talk to them about coping styles, what their child will need that day. Really, a lot of times we don't get that consult before, so the day of, we can meet children. We can go through preparation with them, go through education on what's going to be happening, help provide a little bit of comfort on that day.
How does touring the surgical unit help a child's comfort level?
They can come in, meet a child life specialist, see where they're going to be on that day of surgery, see the pre-op area, go back into the PACU where they wake up. I will show them this prep book that I made. We can go through pictures that they're going to be seeing. They get to see an anesthesia mask. Really go through the education behind, in a developmentally appropriate way, what they're going to see so that they understand it in their own terms and they get to experience those materials and things that they will see in a child-friendly way. Giving them those tools and those resources to be able to explore their environment on their own terms and in their child-friendly way will allow them to really thrive on that day of surgery or just be able to understand it a little bit more. So this demonstrates one way of showing a child what they will be seeing on their day of surgery. Taking a teddy bear or something that they're familiar with and showing them the anesthesia mask, something they are not familiar with, and using it more as a play opportunity, a teaching opportunity, as well as using some medical play. So showing them, this is the anesthesia mask. It smells a little bit like bubble gum. There's a soft, squishy pillow, and all it does, it goes over your nose and your mouth like this, and your only job is to breathe, take some deep breaths. And so we can try it on Teddy. Do you think Teddy wants to fall asleep? Yes. And then I would have the child hold the teddy bear and hold the mask on the teddy bear, and we would count, or we would do whatever the child chose as their coping tool, falling asleep, and we would just play.
What can a parent bring to the hospital to help with their stay?
Any comfort items would be wonderful to bring, whether it is their child's favorite blanket, their child's favorite teddy bear, something that comforts them in a stressful time at home that's going to comfort them when they come to the hospital. We do have recreational activities and therapeutic activities that we can provide on the day of surgery, as well as if they do have to sleep over.
How can parents help immediately after the surgery?
Right after surgery. Kids are very sleepy most of the time. Sometimes kids wake up and they're ready to go. They want a popsicle, they're ready to go. But a lot of the times, many children want to rest. They want that extra time to sleep. Parent can also help a child when they're waking up after their surgery by asking them how they're doing, talking to them, seeing what they need. Sometimes children after surgery will open up a little bit more to their parents than they will the nurse or the anesthesiologist after surgery. And so seeing that familiar face, hearing, how is everything? How are you doing right now? From a familiar voice, they might be able to advocate for themselves a little bit more. It's really important that the child is able to advocate for themselves at that age.
How can a parent's anxiety affect his or her child?
Children definitely feed off of their parents' anxiety. They know when their parent is feeling nervous and they're like, why is my parent nervous? Should I be nervous too, even if they're not nervous? So when parents talk with me, when they come in for tours as well, it also really does help relieve some parental anxiety about bringing their child here for surgery or procedure. Getting to talk with me, although I'm not a doctor, I'm not a nurse, I don't have all the answers for everything. I'm a person that's able to advocate for the child and a parent on the day of surgery for what is going to be the best for that family and the best for that child. Really making a coping plan with parents as well as the kids, getting everyone involved, it really does help on that day.